My name is Nicole Mallon, and I'm going to be doing my informative speech on the role of nursing.
I'm allowing Nicole Mallon to take my information and do, everything's good.
Here's my audience.
Rolling.
So what is the role of nursing? I'm going to be talking about the definition, Florence Nightingale, and my 3 topics that I'm basing on is patient education, proper treatment for a patient, and a patient advocate. First, the definition of nursing. Not everyone really knows what nursing is. When everyone thinks about nursing, they think about just vital signs and medication. There's a lot more that goes along with it, with doing the 7 rights. Not a lot of people know about that. You have to make sure that you have the right patient, the right time, their date of birth if they're confused. And also you need to be compassionate. You need to know a lot about your job. There's a lot of education behind it. So the definition of nursing is you are healthy and not only to be well, but be able to use well every way power in sickness or well in any kind of settings. So at home, we do home care, hospice, you can go to patients' houses, in facilities. And how nursing started was a girl called Florence Nightingale. In 1860, she was served as a nurse for the Korean War. When she began nursing for them, she decided out of that to get into a school for nursing called St. Thomas Nursing, which was the first professional nursing school there was. She was known as the lady with the lamp. So in nursing school, typically in the LPN programs, when you graduate, you get a little lamp as a candle. And that is very important to us nurses. Not everyone understands why, but the background is Florence Nightingale used to go into all of the wounded soldiers' rooms during this war with the candle to check up on all of them and make sure they were all right. So being a patient educator. Not everyone understands that you have to educate this patient. You can't just say, okay, you have COPD, you have CHF, you have edema. No one knows what that means. No one knows what the letters mean. Being there, you have to educate. So COPD, it means chronic obstructive pulmonary disease. Edema, well, what is edema? Edema is usually typically in your legs. For instance, right here, this is all edema. When you can push on that and it comes back, fluid in your legs. What you do for that is you elevate. You need to make sure it doesn't rise up and get into the lungs. So for him, I would tell him, you need to start elevating your legs. Yeah. You need to elevate them for a longer period of time. Start walking a little more. Get the legs motivated to get all that edema. A risk for that is if you start to weigh yourself and you are, say, 150 today, tomorrow you're 152. That's a severe problem. That's too much fluid. So if you have more than 2+, usually 2 pounds, and overnight, you're carrying too much fluid. This is a slide on chronic COPD. This is, I don't know if you can see it that far away, but COPD, how they have the abulus, and this is normal. They start to get way big when you have COPD, giving you harder breathing, harder time. Usually the main one is smoking. So the proper treatment, like I said, is the 7 rights. You got to make sure it's the right patient, right medication, right dose, right route, right time, right reason, and right documentation. Treating everyone, we have bed-bound sores. You need to prevent people from getting sores when they're in the facility. You gotta rotate them back and forth. You gotta do wound changes, Foley changes like he has. You gotta make sure that the urine is flowing just right, which it is. Nice color. He's doing good. And also lastly is a patient advocate. Patient advocate is basically, you're the ears of the patient. If the patient doesn't know what's going on for themselves, you need to be there when the doctor is next to them so they can understand what's going on and reevaluate what the doctor has said to them, or even with the family. If the family doesn't understand what hospice is and isn't ready to get a patient on hospice, you are there to be that advocate to say, you know, this patient is severely sick. It's going to benefit them. Hospice doesn't always mean dying internally, where everyone thinks it is. They can be on it for 6 months, a year. It's to better suit them and have them relaxed. Which, this is the patient advocate, and this is all the stuff that we discuss. We care, illness, the quality of the patient, medicine, surgeries, everything that we are an advocate to help our patients. And that's it.